Brazilian butt lift has surged in popularity over the past 2 decades.
Yeah, the American Society for Aesthetic Plastic Surgery says in the past 10 years alone, procedures surged more than 800%. But this surgery also comes with some risks, and some say it is the most dangerous form of cosmetic surgery, as 1 in 3,000 procedures results in a death. But with the risk so high, why are some people dying to change their look? So joining us now to talk about it, it's New York City cosmetic surgeon, Dr. Mark Albert. Thank you for joining us.
Thank you so much for having me.
Okay, so Dr. Albert, can you explain what kind of goes into this type of surgery, a BBL as it's commonly called, and why is it considered so dangerous?
Right, so BBL is basically where you liposuction fat really from anywhere in the body. Usually it's the abdomen, the flanks, or the sides, and also the back. And then the fat is injected into the buttock in order to add volume and to improve the shape of the buttock. And the reason it can be dangerous is when you're injecting the fat, if the cannula violates the fascia, in other words, the layer that covers the buttock muscle, then it's possible for fat to travel through the fascia, through the muscle, down into the depths of the pelvis and surround the blood vessels, putting tension on the vessels, and they can actually develop a hole in the blood vessel, and fat can enter the bloodstream. And that's when bad things happen. If it goes to the heart and lungs, it can cause major issues. If it goes to the brain, it can cause stroke, and that is how deaths can result from it.
Wow. So let me ask you something. There's some cosmetic surgeons that refuse to do these because they're so dangerous. I know you offer them in your practice. So if it's such a risky surgery, what makes you comfortable to perform those?
Right. So the procedure can be done safely, and the key is staying superficial to that important fascia layer that I mentioned. So when I'm doing it, I make sure that I always know where the tip of my injection cannula is. And I'm often actually using that cannula to tent the skin so I know that I'm as superficial as possible. And in addition, I'm also using an ultrasound probe and holding it and actually watching the cannula as I'm injecting fat to make sure that I'm superficial to that fascial layer.
So you have a special way in which you kind of monitor where things are being injected. Do all practices use this type of instrument as yourself?
Right. It's a great question. You know, I wouldn't say that all surgeons are doing it at this point, but it is a recommendation from the American Society of Aesthetic Plastic Surgery and ASPS, the American Society of Plastic Surgeons. So, you know, it is something that it's a great question for potential patients to ask their surgeons is, are you performing ultrasound during BBL?
Love it.
All right. What's a recovery like, and how long does it last?
Right. So recovery, you know, people are sore usually 5 days or so, up to a week, and then bruising and swelling can often last, you know, a week, 2 weeks or so. And as far as how long does it last, we know that we lose some of the fat after it's injected. So at 3 months, the fat that survives or the fat that's developed a blood supply is going to be with you for good. So it is a permanent procedure.
So let's talk about some of the alternatives. We've seen in the stores, they have the pants that actually come with, like, I guess, BBLs in them or little pads. What are some safer alternatives then to getting the surgery?
Right. So filler is certainly an option. There's a filler called Sculptura. There are hyaluronic acid fillers similar to those that we put in the face. Those can be injected in the buttock. You can put in buttock implants, which are made of silicone, and they're similar to implants that are put in the breast. You can do skin removal procedures to tighten the buttock and to improve the shape. And there are also non-invasive devices that deliver electromagnetic waves to the muscle, and it causes muscle contraction instead of going to the gym. I'd say that the BBL results are more dramatic than these devices, but they're an option.
All right. Well, that's a lot to consider, Dr. Albert. Thanks for joining us today to talk about it all.
Thank you so much. My pleasure. Thanks for having me.
You can find more info about the work Dr. Albert does by visiting his Instagram page at Albert Plastic Surgery.